Hello and welcome. This is Dr. GERARD CUOMO here in Boca Raton, Florida. As we are in the early part of August here in Florida, we have possibly a tropical storm turning into a hurricane called Emily, and we hope that that does not come near us and veer away, whether it goes north or on the south side of us. Florida does have its number of islands to protect it, but we're in a little limbo, waiting and seeing. Let's talk about Julie's case, and or Julia, and she has had a situation where her lowers were all failing, and this is basically Julia's case, pre-op model taken by the surgeon's office. The periodontal surgeon took the alginate, and you can see that she had 1, 2, 3, and let's say 7 teeth, 8 with this broken off cuspid, number 27, and then she also had an old Leonard Linkow implant that was removed on the lower right side. I don't have an x-ray available right now to show you, but you can actually see the antiquity of it, but still 45 years later. So we're at the end of change now. We're going to go ahead and remove all of her lower teeth and come up with a prosthesis that is fixed removable, okay, or a fixed denture, I should say. So in other words, when we screw this in place, the patient will not have to worry about removing this to clean it. She'll come in for her cleanings and hygiene, and if we have to remove this, we just go into these little vent holes here and take our driver and remove that. So for those of you who don't know about this type of dentistry, this is a nicer way to go than other than wearing a denture, and it's much more cost effective. We're making this out of plastic with some metal reinforcement internally, and we're using some prefabricated implant abutments made by the same company, and so this would facilitate, along with some denture teeth, quality denture teeth from here we're using Ivoclar teeth that are plastic, but they're very natural looking. All right, some things about the impression itself. We instruct our labs to create this gummy portion of the model to help with the adaptation and simulate the natural tooth, natural gum tissue. And so we've got this that snaps in beautifully. Now, some may say this is similar to what we call an all. Those particular cases have a lot more angulation as they're expressed in the journals, and they have to go with more of these multi-level abutments at the time of impression. Here are these, even though these are somewhat angled, not to the point where they're beyond an acceptable try-in. And we've actually covered some of the ways that you can check in other videos, but for you who are listening in out there regarding fixed dentures, this is the way to go. And then patients can basically water pick underneath and floss, and they use their hydrofloss and floss and to keep this clean. The type of implant impression that we've taken, these are my design implants, modified certainly with the Straumann bone level type. They're all actually joined together in the mouth. And then before we do this pour, the lab would then inject the soft tissue, pink soft tissue area. You would see some long struts in between connecting these analog, lab analogs together as well. And by joining them, we're reducing the amount of distortion in the pour-up due to expanding and contraction moduluses and coefficients. So that's it. I just wanted to brief you on this. We checked your vertical dimension. We're going to ask our lab now to festoon these a little better. If you look at them more closely with the microscope, You can see there's some voids in between, and those all have to be really sealed perfectly, especially inside as well. We also want to make sure that these little chimneys are clean and vacant. We don't want any of the material to go down in them. We did have 1 or 2 cusps that were up a little bit on this lower left side. This is number 19 and 20. We're going to have the lab rotate these teeth so that the necks are further out buccally, and that'll bring these lingual cusps down. All right, as we get ready for our weekend, I wish everyone a very safe weekend, and certainly we'll hopefully be around here to do some more video recording after Emily has passed. All right. And take care. Dr. GERARD Cuomo, and just enjoying the world of implants, and our patients are just terrific to work on. And feel free to comment. We're now on Facebook. If you want to go ahead and just write a comment or just to say hello, we'll be happy to say hello back. All right, take care and have